So the Northern Territory PHN last year commenced commissioning the Outreach Health Services program. The aim of that is to increase an access of a range of health services, including expanded primary healthcare services to Aboriginal and Torres Strait Islander people. That's for the prevention, detection, treatment and management of chronic conditions. At the moment, the program provides allied health services to over 80 communities across the Northern Territory. We worked with a range of stakeholders to co-design the Outreach Health Services program. It began with the Northern Territory Primary Health Network's Comprehensive Primary Healthcare Advisory Group, who were guiding and providing expert advice for the commissioning of this program. And through that, we worked with our needs assessment team and developed a resource distribution model. And so that model looked at the different needs of different communities across the Northern Territory as a way of allocating resources and funding at a regional level. And the information that went into that methodology was around access, population, need, so there was health data involved as well. And so once that model was used, that was part of the information that we took out to each of the regions, and we held regional groups with all primary healthcare services, and we discussed the resource distribution model and the funding available for them in their region. And then we talked about different options that they might want to be considering for their region. And we also looked at what was currently being provided to see if there was any opportunities to improve things. And through that process, we actually set up working groups in each of the 5 regions of the Northern Territory, who now meet on a regular basis to monitor the outreach program and to provide recommendations and guidance to the Northern Territory PHN so that can support our decision making for the program. So there was a number of commissioning principles that were used as part of the process to co-design. Being collaborative was probably the first one that we looked at in terms of engaging with stakeholders at the very beginning and working in partnership with them to identify opportunities and processes or approaches for co-design that would work for health services. Taking a whole of system view to commissioning was really important. Different parts of the health service are funded through different programs, and so through taking that view in the beginning, we looked for synergies. So we had great conversations in the working groups around alternative funding sources that could be joined to add greater value, or other areas of funding that were funding similar services, such as integrated team care, and how this might overlap with other areas of funding, such as the National Disability Insurance Scheme. The other principles which we sort of kept throughout the process was around strengthening health services and building the capacity, particularly of Aboriginal community-controlled health services, which aligns with our commissioning policy. So through providing a greater ability to be involved in the planning and the management and perhaps even the delivery of this program, that was a great way to be able to work with health services to identify areas that they might want to have more involvement in. So that was one of the other principles that we definitely followed. So there was a number of key learnings throughout the co-design and commissioning process. I think it was really our advantage moving slowly and working in partnership with health services. Our approach with co-design was around ensuring that there was multiple different ways for health services to engage with us throughout that process. We did go and attend regional meetings face-to-face. We facilitated them via teleconference. I would have one-on-one conversations with health services who were not able to attend. Some of our smaller health services that are quite remote might have one person working during the day, and so their ability to attend meetings is very limited, but they were very engaged with the process. One of the other learnings that we have from this process is around timelines and being flexible. At the beginning of the process, we had a timeline where we had milestones and deliverables at different points. And as we went and talked to the regions and they had competing priorities and different things came up, we definitely changed the timeline, and we were flexible with that approach to ensure that all stakeholders could participate in the process. I think that if there's a very tight time frame and there's no room to move, it might be quite challenging to make sure everyone's part of the decision making and you get the outcome that you're looking for.